morning, everyone, and welcome to the Mountaineer Farm Talk. My name is JJ Barrett.
And I'm John David Johnson.
Like I said, we'd like to welcome everyone. If you're interested in livestock nutrition, animal health, forages, pasture improvement, farm management, crop production, country western music, rural health, gardening, and horticulture, or any other topic related to agriculture or farming, join us every Friday at 10 a.m. for a Mountaineer Farm Talk. We will learn, laugh, share, and we will enjoy a cowboy cup of coffee. We encourage audience participation, so have your questions ready. And this week, our special guest is Dr. Darren Matlick. Welcome, Darren.
Thank you.
Darren is he's at Potomac State. He is our WVU Extension veterinary specialist, and he also serves as an advisor for our bull test experiment stations, our young sire program and heifer development. That would be at Wardensville and at the Southern Bull Tests at the Jack Crank Farm. And he also teaches classes, does consulting. Darren, what other things do you do for WVU?
Oh, I think you've nailed it. I mean, I'm a clinical vet for the farms at Potomac State, Wardensville, and Willow Bend. So that's enough. That's good.
Don't be bashful. We know you're a doctor.
That's plenty. That's plenty.
So, go ahead, John David. We'll go ahead and start in with a few questions for the doc.
Okay, well, we're kind of wrapping up with the spring calving, and we might get into that calving difficulties a little bit later. But, kind of coming into the spring, my guys are gearing up for all kinds of, vaccinations, getting that, those cows on fresh pasture, exposing them to the bull coming up shortly to get them back into that spring calving cycle, excuse me. So what advice do you have for them, especially on vaccinations this time of year?
So I certainly like a spring turnout vaccination and prior to, if you're going to artificially inseminate, prior to turnout, I want to vaccinate those cows. So we just had a little discussion before we started recording here about vaccines, but I definitely want to use for me, I like to use a modified live. It's IBR, BVD, PI3, BRSV is lumped into one 4-way vaccine or 5-way vaccine with leptospirosis, which is a bacteria that causes abortion and can cause low conception rates. So we want to definitely give that to the cows. The calves, at the very least, I'd like to get a black leg in those calves, but I also would like to get them the viral vaccine as well. So the 4 and 5-way viral vaccine, the IBR, BVD, PI3, BRSV, and we can do modified live on those calves at that point in time in the spring. And then a black leg on the calves. Another option is to do Pastorella vaccine on those calves as well. But it's not 100% necessary. I mean, if we were in Nebraska, Kansas, we would have to give that because they get a lot of summer pneumonias from dust, and we don't always see that unless we're in a dry season where we get a lot less rain and it gets dry. Then we may see that sometimes. And last year, I saw some summer pneumonias. So that Pastorella would be good to get in them, but not 100% necessary right now. Definitely want that pre-weaning, prior to weaning, I want that Pastorella in them. So right now, the viral vaccine and the lepto, and for the calves, the viral vaccine and the black leg is usually what I do prior to turnout.
Okay.
Now, I did see a question that you put forward in the stuff you sent me. The one about when can I vaccinate calves?
Yeah, that's the I guess a lot of my producers will ask, and I'm sure John David's the same. They like to give, some of them want to give them, 3 or 4 weeks old a calf. My question is, how early can we give the vaccine, and is the 4-way, is the black like a 7-way black leg enough, or there another vaccine we should give calves at an early stage?
So that's a great question that nobody's really ever answered. I can just tell you from a practical experience, the reason the label says 3 to 4 months is because of maternal antibody interference. So the colostrum that calf gets from mama provides them IgG antibodies that give them an immune base that they against hopefully things like Clostridium and our viruses that they've been vaccinated for. Anything that cow has seen in her lifetime, she puts into that colostrum, and that calf has that immunity in the early stages of life. So the reason they say 3 to 4 months is because we don't know for sure if you're going to get maternal antibody interference when you give that vaccine. However, if there's a problem, certainly so kind of a simple way to look at it is if you're getting pneumonia on calves when they're a month, 2 months, 3 months of age, then obviously they don't have an immunity against whatever agent's causing that. So scours is another one we can talk about in a little bit, but I don't hesitate to vaccinate those calves because it never fails. You're gonna get ready to AI and turn out and you're gonna have 10% of the herd that's a late straggler. Those calves are only going to be 2 or 3 to 4 weeks old, or 2 to 4 weeks old when you go to get ready to AI or turn out the bull and put in pasture. So we vaccinate those calves anyway because we don't want to just say, oh, we're not going to vaccinate them because they're too young. So this is a long answer. I'm sorry.
That's okay.
The research shows that the immune system changes between 3 and 5 weeks of age. So it was always the thing that if we could avoid that 3 to 5 week of age of that calf to vaccinate would probably be best, but that's really hard to do when you're running through a whole herd full of cattle and calves to avoid those. So normally we just do them anyway. So I guess the original question is, what would I give those calves?
Yes.
So I would give them, I mean, definitely before turnout, like we talked about before, I'd definitely give them blackleg. The early vaccines that we sometimes will do, obviously the scours, oral medicine or vaccine, first defense boluses, calf guard. I don't want to mention brand names, but there's several of them that we can give a calf when it's born to help boost those antibodies against E. coli, Clostridium, and Rota and coronavirus. We also can vaccinate the cow prior to, I'm going to answer all these questions at once, Anna. We can also vaccinate the cow
Can't get
prior
it right in twice.
prior to calving. So, yeah, I don't know if I ever answered the original question, but I don't hesitate to vaccinate those younger calves because the worst that's going to happen is you're going to get maternal antibody interference and it isn't going to work.
What's the youngest then? You're saying about 3 months?
No. I'll if I've got a 3-week-old calf that was a straggler and we're vaccinating, I'll vaccinate.
With like a 7 or 8 way blackleg.
Yep.
Okay.
Yeah.
What is your thoughts on kind of a nasal, like a Enforce or something like that, a TSV that, is going to bypass that blood-brain barrier and wouldn't be affected by the globular proteins or the immature white blood cells? Would you, recommend they give a nasal?
So when are you talking?
For turnout.
Oh, yeah. So that is a good strategy because it works on the local humoral immunity. That is a good strategy to use. I'm kind of torn on that one. So as an example, at Potomac State, our farm manager here liked to do that. He would even do it earlier than that. And we had pretty decent success doing that. I like it. The only downside is that I don't know how long that immunity is going to last. Okay. So I do still like to stick a needle in there and get it at some point, but you can start with so if you do intranasal in the spring before turnout with your Nasalgen, or my brand. So TSV, Nasalgen, Merck's coming out with a new one, and then the Pfizer Zoetis one. You can use those and just then come back in and booster those calves pre-weaning, and that's fine.
Okay.
Yeah.
Because what my guys like to do, I've noticed a trend. They like to give that nasal as just kind of a booster with the shot, and that way it gives it automatic immunity till that shot kind of kicks in. Or if it's going through a stressful time like transport or something, they might give them a nasal, or just give it that quick coverage. Because
Sure.
you hit it right on the nail. I'm not sure how long that coverage lasts.
Right.
It's kind of a short time deal. That they just do for just kind of a booster, very short immunity there.
Yeah, so I like to use it in a feedlot setting when they're coming in, or a stressful situation like that. Some of those vaccines also have a boost to the immunity. It has some interferon in it, and interferon can actually be a little bit of an immune boost.
Okay.
So that does help. So yeah, I'm not opposed to them at all. You just can't rely on them 100% alone.
Exactly.
Aaron, a follow-up on you were talking about lepto. I don't know, I wouldn't call it the silent killer, but it's sometimes a topic that we don't talk about a lot. Is there still an issue in West Virginia, eastern United States here, of lepto? And give us a little insight on how often we need to vaccinate that, how much of a problem it is.
So it's a really big problem still. So lepto obviously is carried by wildlife, and it's carried through their urine. So if they urinate in a pond or any,
Is that mostly deer, or
it can be anything, rats, anything from
really?
a rat to a bear can carry lepto. So any
Not
mammal.
bats though, right?
Bats, I've never heard of bats having it, but
Don't scare us here.
so it's carried through the urine, and they will urinate in a pond or some source of water. Cattle drink it, get infected, and then they usually, like I said, the two things that can happen is infertility and abortion, and usually late term abortion. So those cows that were preg checked pregnant, and then you come to calving time and they still haven't calved, and they still haven't calved, and they still haven't calved, and then either you sell them or you preg check them and they're open after they were supposed to be pregnant. They probably aborted out in the pasture somewhere along the way, or you might see an abortion at 7 months with a fetus that's decent size but not fully developed yet. Those are probably either going to be a genetic issue, but more likely going to be lepto. As I like to say, I have a lot of little sayings, and one of them that I learned in vet school was common things happen commonly. So lepto is a very common thing that happens. So in a perfect world, we would vaccinate 3 times a year. That's extremely hard to do management wise. So if we can get that in at least spring and fall, that would be great. So at least twice a year, every 6 months, but preferably 3 times a year, which is no one does. I don't do it.
That vaccine does not just doesn't have a lot of it doesn't last that long as far as protective immunity in the body.
Right. Correct.
Cows.
Correct.
6 months. Okay.
So if you're given,
we don't pay attention to it, we should.
Yeah, if you're given a modified live or a killed vaccine in the spring, just make sure it has with lepto, and it's going to say L5 or with lepto. And then if you go in the fall and you vaccinate, our university programs, we have you give a modified live in the fall. I know some guys will not give modified live in the fall. They're giving it in the spring and just booster lepto in the fall. So I'm not promoting that. I'm just saying if you don't give anything else in the fall, you have to give lepto.
Okay.
Because if not, you're going to get in trouble. and that's on the cows and the heifers. If you had calves feeding in the barn, I wouldn't 100% worry about it, but they can be carriers. So you have to be cognizant of, just because it's not a female, definitely want to give it to the bull. But if it's a steer that's being fed in the barn and he's going to have any contact with the cows, he can be a carrier too. So,
All right. JD, have another.
What about just to kind of finish up on the vaccine segment here? What do you think about, we give respiratory, definitely everything to cows and all. I've had a couple producers asked me this question in the past. How effective is the black leg on grown cows that's already been vaccinated prior to that? Should we make sure we definitely give those black leg boosters to those cows, or is that ineffective? And another thing is, we always give my respiratory and black leg shots there at weaning as well, because I'm in the calf pool, so we have a vaccination plan that we actually follow. But on those cows, that black leg shot, how effective is that, and should we make sure we get it in there?
So my answer is that normally I don't do adult cows, so anything over 3 and up I don't do. But there's a caveat to that. If we have a problem, I've been on farms who have had some perfringens, Clostridial perfringens problems, type C and D, then we need to vaccinate the whole herd.
Yeah.
Go ahead.
Hitting on that, Darren, just to follow up with this Clostridium, I know that I've had a couple producers ask me, and I about that Clostridium C and D for the calves. I don't think they call it enterotoxemia, but there are a few, maybe might be 4, 5, 6, 7 days old. They'll get that scours and die within 24 to 48 hours. Is there any treatment for that, or is what you're saying about giving the cows a blackleg shot part of a prevention program for that? What do you think about that?
So I think if you gave the cows as a calf, if we're given that program appropriately and getting boosted, up until I give it to heifers too. Okay, heifers, young bulls should all get blackleg vaccine. They should have some immunity to that in their colostrum already. That's not one that seems to be an issue, other than the C and D can be a problem. So if I see that in calves, and I know it's C and D, because those newborn calves, if it's within a week old, it's usually E. coli scours. So we'll jump the scours and then come back to the Clostridium. If it's within a week old, it's usually E. coli. Rodent coronavirus can sneak in there about 5 to 7 days, but usually it's 7 to 12 or 7 to 14 days. And then after that, you usually don't see Clostridium until after 2 weeks. So do you know what age they were losing those calves?
This was a few years back, but they didn't think it was E. coli or anything. They were thinking, it might have been older. It might have been calves that were a little bit older.
Yeah, if they're
like
older,
I said, they were like within 24. By the time that they saw them sick, their calves were down, and 24 hours later dead, no matter what.
So I guess where I've seen that the most is on dairies with bottle fed and bucket fed calves, because the bottles aren't getting cleaned out appropriately, and then you get the bacteria growth in there. And I've seen some C and D that way. I haven't seen that a whole lot in beef calves that I've diagnosed. Okay. But certainly if it was a problem, I would give it to the cows. I have herds in the past in practice that they gave blackleg to the 7-way, Clostridial 7-way, to the cows because they had issues. So they gave it because if you're in an area that floods a lot, probably a good idea to do it in the cows, because when you turn that soil over in a flood or get garbage in there, we have definitely seen black leg in those situations, and even in older animals. So most of the time it's a calf problem. That young growing calf that's 6 months old or 4 to 6 months old. That's usually when you see it.
Okay.
But it's not out of the question that you can't see it in something older, but it's pretty rare. But if you have that situation with the flooding or in an area like that, then I would probably give it. So the original question was about, I think I stated it, but I'll go back over it. I give it to all calves, and it has killed vaccine, so it has to be boosted. Okay. And I give it to, so that's I give it a turnout and pre-weaning and weaning, which anymore, we can talk about this if we have time, but I do not do a pre-weaning and a weaning anymore. I've got a different school of thought. My school of thought is I do 2 pre-weanings, okay? Because I found over the years that if we do a lot of stuff at weaning, we have trouble with calves getting sick.
Are you
So
talking
I
about
like,
preconditioning calves here?
yeah. And if in a perfect world, it'd be any calf that gets sold, right?
Okay.
So I would like to do, and this is just me personally, if this is Darren's opinion time, I would like to do a pre-weaning and then come back 3 weeks later and do a pre-weaning and have that in within about 2 weeks of weaning. Okay, so I find if we stress those calves, inevitably, if we're weaning in September and October, I see it's hot. It can be hot, and we can go over that too. That vaccines don't work when it's really hot. I always say above 86 degrees, and that's something I learned through a meeting. If it's above 86 degrees outside, those cattle are going to get extremely hot when you're working.
Are you saying, Darren, that? And I know that sometimes we think that we bring calves in, we go ahead and we vaccinate them, we warn them, we run them through the chute. That all that stress is that the reason why maybe some of these vaccines aren't as effective as they should be? You're saying that we should give some of these before we wean calves, and we'll actually get a better response from these vaccines that we're spending all this money on?
Absolutely. So we always recommend, if you look at our extension flyers or handouts, we always recommend a pre-weaning vaccine. Then at weaning, you're doing a booster, which usually isn't as hard on the calf, a booster, but it's still a modified live, especially can sweat them a little bit. They can get a little feeling not so great. So the other part to that is above 86 degrees, there's been plenty of research done that says that this calf or any cow calf, anything will not respond as well to the vaccine. If you can imagine, not your whole facility is under roof and you've got those cattle standing in a chute and it's hot. If you take temperatures as they're coming through there, they're going to be elevated. So the research showed that when it's that hot, that the animals do not respond as well. I'm not saying they don't have any response. They just don't respond as well to that vaccine, and some not at all. So if we can work those animals in the cool of the morning or the cool of the evening, we have a better opportunity to get a response out of that. So anyway, what was the original? We get to sidetracking.
I think that you answered that one pretty well, but we got ahead of the ball game. But JD, do you have
Ronnie, you got something? You were looking like maybe you remembered what the original question was.
Well, I got something that combines kind of this together. What about the people that use the weaning nose clips? I've kind of started doing that. I've kind of almost done what you were talking about, doing the pre-weaning. So I'm giving the shots, to the calves, putting the nose clips in, leaving them on the calves for 2 to 3 weeks there on the side of their mother before they get that, before and after there. So, they've had that shot for about a week to 2 weeks, that second shot before I pull the mother. And of course, this varies year to year with the forage, how much forage you have, and how soon I pull those cattle out of there and wean those calves off. But I've noticed a difference over the years with the nose clips in weaning and leaving those calves on the side of their mothers, but not being able to drink the milk, nurse, and then moving them to more of a forage-based diet along the side of them, their
Yeah,
mothers
sure.
before I pull those cows.
Sure. So anything we can do to reduce stress. Fence line weaning is a great tool. A great option. Um, I know we've tried the clips here years ago at the university, and the only problem we had, you get some calves who figure it out, and then you get some calves that lose the clips. That's the only problem I saw with those. So it's a good idea. I mean, I think it's worth trying. So fence line weaning, the clips, or some sort of treat so those calves are ready to be weaned, certainly are all things that help that weaning process. I've been on the worst end of it when we were going to feed background calves, and we took them straight from mom, shipped them, and put them in a barn, and seen the worst of the worst. Not really, we didn't have any death loss, but we had certainly a lot of treatments. But those situations are the worst case scenario, is taking those calves completely away and shipping them, and it's hot and it doesn't work out real well. So if we can do anything to ease that burden of weaning, that's the absolute most stressful time on that calf in its life, is being pulled from mom. So as you can tell from the noise that you hear after you do it. So
Darren, just to not to switch gears from vaccinating, but originally we talked to you about prolapse,
yeah.
which can be a problem in what causes uteral prolapse, and then what's the difference? I have a lot of people. What's the difference between a vaginal or a uteral prolapse? What causes these things, and then after the vet comes, and what do we do about that cow once you come and stitch her up, or you have to treat her? What's next for that animal? Should we go ahead and sell her, and what's her future in the herd?
Okay, so we'll start with uterine prolapse. Uterine prolapse is usually caused by two things. One is a large calf that you have to pull, or not even always. Some cows can get it done on their own, but they struggle to get it out. It fatigues the uterus, so that uterus has muscle, is a smooth muscle. It fatigues that uterus, and then that uterus it doesn't, once the calf's out, it doesn't start to involute because the muscles are fatigued, so it comes out. Okay, that's one, so large calf. Two, which happens more commonly in dairy cows, would be hypocalcemia or milk fever, because they can't contract that uterus down. That can cause uterine prolapse. When the vet comes and puts that back in, I would ask him, do you think that went smoothly, and could I rebreed her? And my opinion is, if putting it back in, so no necrotic tissue, it hadn't been out for a day and dying. It's been pretty recent, like within hours. You put it back in, it's been pretty clean. The key is the caruncles on the cow's uterus. So you have caruncles on the uterus, cotyledons on the placenta. Together they make a placentome. The cotyledons on the uterus, the caruncles on the uterus, if they have been pulled off in the process by trying to put it back in, and bloop, there goes one, they look like a big mulberry. If they fall off, that's where your placental attachment goes when the calf is in there. So if that falls off, then her chances of rebreeding, she'll probably rebreed, but she won't be able to attach to the placenta, so she'll abort. Okay, but if that goes in clean and smooth, she can rebreed. Okay. That comes into a management decision, and her chances of reprolapsing will only be if she has a large calf again or hypocalcemia. Okay, so a prolapsed uterus can rebreed if it's put back in cleanly and you don't lose those caruncles. A prolapsed vagina is hereditary or nutritional Moldy feed sometimes will cause it, but there is some genetic component to it. If they do it, they're going to do it every year. So it depends on, I tell the story all the time. One on a Hereford cow put back in, told the lady probably ought to sell it because it's going to happen again next year. I came back up the next year and put it in. I said, I see you didn't sell her. And she said, no, I meant to. I come back up the third year and put it in. And she said, I think I will sell her this year. So it's going to happen every year. So you don't want to keep that.
Darren, what does it say though? The research say with the, I mean, I've had some recommendations that once a cow, as far as uteral prolapse, once they uteral prolapse, just go ahead and after they get sewed up, after you had to give them antibiotics, go ahead and cull them because they're predisposed to have that issue again. But you're saying maybe that's not the case.
Not in uterus, but in vagina, yes, absolutely in vagina. So in uterus, in either case, they should, the one's already calved, and if the calf's alive, then she can raise it. If it's dead, then that's a management decision on whether you want to sell it anyway. Okay. The prolapse vagina is going to happen usually prior to calving. Occasionally it'll happen after, but usually prior to. And that cow I'm probably going to keep and let her raise that calf and then get rid of her in the fall.
Okay.
But the prolapse uterus, as long as that calf's alive and she's able to nurse it, then I would, in my opinion, I keep her. And then if I don't want to keep her because of that, I could sell her in the fall. But like I said, if everything's done cleanly, she can rebreed.
Okay.
And how important, with these problems we may have in this production, we kind of wanted to mention this and to hear a veterinarian's opinion on it too. We always push the producer veterinarian relationship. How important is that to a producer to have that?
Extremely. So I try to tell, as an extension veterinarian, I think I can say this, and people can throw eggs at me, and that's fine. But
bricks, we're gonna throw bricks.
Yeah, bricks.
Virtual bricks.
The virtual bricks. No veterinarian wants to establish that relationship on Saturday at midnight when you have a problem. Nobody does. Trust me. I'm one of them. I don't want to establish that relationship at midnight on Saturday and say, I have a new client call and say, hey, I never met you, but I could use your help right now. I got a calving problem. So that relationship needs to be established for when you need them, one. Two, they can help you with things we're talking about today. And three, you have to have a VCPR if you ever want a script, whether that be injectable, feed, whatever. You have to have that relationship. So I think it's pretty important. I mean, once a year is a VCPR. So if you have a vet out once a year to do preg checks or whatever, that's all you need.
Okay. Or give you a chance to throw some pot shots back. A lot of producers say that our large animal, the reason that they're shy about having large animal vets on the farm is just they charge too much for farm calls. They're too expensive. What do you say to that?
I can see that from a producer standpoint, from a veterinarian standpoint. I mean, we could have a lot of economics about this, but veterinary college right now costs somewhere about $60,000 a year. So student loans are through the roof. We're talking several $100,000 for student loans to pay back. Equipment, overhead. When you pencil it out, if they only charge $25 an hour, they are not going to make it. They're not going to make it. So common is probably anywhere from 100 to or 80 to 150 an hour. And I know that sounds expensive. Have you ever called a lawyer and had them start the phone call on you and charge you when you get on there, or even a plumber or an HVAC guy? I mean, everything's expensive. And so I think the key is that you got to find a veterinarian. One, you have to find one in West Virginia, but two, you have to find a veterinarian that you can develop that relationship with. It's gonna, my theory and practice was always, if I can't help you make more money, then I'm probably not worth it. So, you know, hopefully you find that veterinarian that you can have that relationship with, where you can call them and ask for advice occasionally, and then call them and have them help you when you need it, and help you make or save money by, you know, working on whatever, preg checks, vaccination programs, bull breeding soundness exams. I don't think that question was on there, but on the meeting I was on last week, they put a dollar figure to bull breeding soundness exam, and I'm gonna have to go back and listen to it. But basically, and it's said, and I always say this too, if you do one procedure a year, I would check bulls for the veterinarian. I mean,
How much do you charge for the, not to, a couple years ago, I did just a local survey, and I think about 70, $75 to come out and check. Was that sound right? $75 to $100 to do
yeah, well, if you're checking one bull, yeah, the more bulls you do, the cheaper it'll be. So, you know, probably if you did 10 or more, it's going to be 30 to $40 a bull. And if you think about that bull being not fertile for whatever reason, whether it's he's got a penis issue, or he's got sperm that's not up to the standards, or, you know, some sort of other problem, if that is caught and you don't try to use that bull, that saves you a pile of money, because I've seen train wrecks with bulls who weren't fertile, and you end up with, at one time I had 33 out of 50 cows, 33 were open because the bulls weren't up to, you know, up to par. So
yeah, talk about that, Darren. The doing some legwork for this program, some research. There, I was reading some articles. I think it was in Beef Magazine, but they were. Do you find that more? They were saying the more they look into the more vets, the more checks they do, and the more they look at it, the bigger of an issue it is, as far as with infertility in some of these bulls. Do you find that? Is there more infertility?
So I think as the technology advances, which it already has, I know the big sire companies, AI companies, have found that some bulls are definitely more fertile than others. So even though they still have the same amount of sperm in the straw, live sperm in the straw, that others are more fertile. So that is something that's beyond me. I can't, and when it comes to that type of biology, that's something that I can't really talk about at this point in time. But as far as your question was, are some bulls more fertile than others? Is that what your question is?
Um, well, I mean, we know that that's true, but I was just saying it. I think the article was more where you're talking about the as the technology advances, because they were talking about different abnormalities for and motility for sperm, that the more they find out about that, the more issues that they're finding with some of the bulls that they check.
Sure. So, one of my other sayings I'll say is, when you look for it, now you got to answer the question. So when you find that research, now you got to look more and answer the question. So I think that's why we do bull breeding soundness exams at the bull test stations. That's why we recommend it, because even older bulls, people will think older bulls, oh, they bred last year, so they're fine. Doesn't mean that they're going to be fine. Yes, more than likely they're going to be fine, but not all the time. You're going to find injuries. You're going to find maybe infection of the seminal vesicles, or the prostate gland, or the epididymis in the scrotum on the testicle, that can kill semen, kill your motility, so you'll be dead and won't have any motility, or can change morphology as well. So it is definitely an issue that if you don't look, you won't find it, but you may find open cows.
What about, taking the bull to the stockyards when there's a vet there? it's best to have the vet come out if possible to your operation. That way you don't have any exposure or biosecurity problems or whatnot. But what it does the risk outweigh the benefit, or the benefit outweigh the risk with taking that bull to the stockyards with all that movement going in and out?
So I guess if I had to pick, the worst place to do it would be the stockyard.
Yeah.
And I don't mean to stop. So sometimes you're only ever going to get BSE clinics from veterinarians if you can pull those bulls together and have them at one spot. That's great because you're getting the bulls done. Biosecurity, it could be a problem. And if we ever have any biosecurity problems, it could be at the stockyard, and that's not the stockyard's fault. It's just a matter of how many animals run through there. So if I had my choice, I'd rather not, but it's kind of a catch-22. I mean, if we don't do the bull, we can have a major problem. If we do go to the stockyard, we could have a biosecurity problem. So I definitely would rather go to the farm and do it, but I know in some cases they're gathering bulls together to get those done so they can get done. And I don't think that's I wouldn't say we can't do that, because that's some ways the only way the bull's going to get done. But in a perfect world, no, we would stay on our own farm.
Okay. Not to, you touched a little bit on this, Darren, but as far as, it's no secret in the ag industry, I'm talking to farmers, that there's a shortage of large animal vets, especially in rural areas. What some of the, what can we, I know that there's some programs that they have, there's legislation to try to get more large animal vets, but what's your take on that, especially here in the Mountain State?
So my answer is not usually one that people like. I'll warn you about that. So I always say if the animals are there, they'll come, and that's meaning the animal numbers. So there are some counties around the state that have very few, the population's pretty sparse. So therefore the amount of calls that this vet would get would be tough to stay in business. I think we are seeing a trend of more people willing to travel. Vets traveling to areas of need, but that's probably not everywhere. But the reason being the small animal is way more profitable is the big reason that you don't get as many large animal vets. That you see a lot of large animal vets that'll do large animal for a few years and then they go right back into small animal and never come back out of the building. And that's because this job isn't easy. Okay. You're getting called all hours of the night in the springtime and beef practice, and sometimes in the fall. But the spring will beat you down, and they get tired and they decide that they would rather stay in there and spay cats and dogs and do that kind of thing and make more money. The problem is real, right? I mean, we don't have the ability to cover all these areas in the state that need covered. But the opposite problem is it's hard for a veterinarian to set up in a very rural area and make a living too.
Yeah, as far as what we're doing right now is a Zoom call, with a client. Have you done that, or working with clients that way? And if you do, how do you charge for that service?
Well, I'm in university setting now, and with clinical rotation with the farms on campus. But yeah, I mean, it's a great technology. I was in a meeting years ago, probably 5-6 years ago, where the feedlot vets in Canada were they taught their beef lot managers how to do a necropsy, and then they would send photos directly to because they would drive hundreds and hundreds of miles to these feedlots. So knowing they couldn't get there in a minute's notice, they would teach them how to do that, and then they would take pictures, and then they would teach them how to collect samples, But then, the charge was that you're consulting with the veterinarian. That's where the charge came in. But it was something that you could resolve maybe today versus 2 weeks from now. I get a lot of pictures. People send me a lot of pictures of things going on and say, what do you think this is? Sometimes that's not enough information.
What do you think?
Sometimes that is probably enough information if it's obvious. But it's a tool I think we probably are getting better at utilizing. Telemedicine has become a huge deal with the pandemic in human medicine, and a lot of states in veterinary medicine were approving that too. Because before, a lot of states wouldn't allow telemedicine in veterinary medicine, but now they're allowing it. And I've had several times at the farms where if I'm away, they'll send me a picture of something and I know what they need to do, and sometimes I don't. So, but it definitely can help. Definitely can help. If you have that VCPR that John was talking about, then you can do that. But if you do not have that VCPR and you send pictures to the veterinarian, he's probably not going to look at it because he won't know who the heck you are.
Right.
So,
couple of things you've alluded to, Darren, as you went through and talked about nutrition, some of those type of things. Just can you talk a little bit about the importance of a good mineral program as we look at vaccines and those type things, and how some of the emerging issues that we're dealing with, how we can handle those kind of from a biosecurity standpoint. You mentioned once that once you find it, you've got to deal with it. So I think, there's some emerging things that from a biosecurity standpoint, we may be able to manage through.
anaplasmosis and mucosis, is that what you're alluding to?
Yeah. Mm-hmm.
Okay. So mineral program is extremely important because we know that if the mineral profile of that cow is not right, then her immune system's not going to be up to par. We know some of the metabolic issues we can get with hypocalcemia and grass tetany and some of those other diseases that can be arise from a poor mineral program. So minerals are extremely important. I'm not going to tell you which ones, but I know one problem that we have that I'll allude to here quickly, and it also leads into the next discussion. When we had medicated mineral, people would feed medicated mineral. If you looked at the tag, a lot of medicated mineral had a low phosphorus at calcium to phosphorus ratio. The calcium might have been high enough, but phosphorus was really low. So that profile was off because it was meant to feed in a very short-term situation, not a long-term situation. And I know people fed it year round all the time. The other part of that is the high mag mineral. We don't want to feed that year round because then it was cheaper. So that's kind of the nice part about it. It's usually cheaper. But the magnesium, high magnesium, you have to subtract other things from that mineral. And so we end up with not quite a balanced profile like we'd like. So I always look for that 2-to-1 mineral in the summertime, in the fall, that whatever concoction you want. So let's go on to the diseases that we have seen. The one reason we've seen a reemergence of anaplasmosis is because of what I just said. We've had some mineral that used to be medicated, CTC, and now we're not feeding it. And then now that we're not feeding it, we're seeing anaplasmosis. So anaplasmosis is a tick-borne disease that responds to tetracyclines. So if we don't have that medicated feed in there, which we're not now, in the mineral or in the feed, I mean, you can get it in the feed for certain situations, but not to feed cows just regularly, you will see other diseases pop up, and that's when we see the reemergence. Since the 2017 VFD rule came about, we've now seen an emergence of anaplasmosis. So anaplasmosis, the quick and dirty is if we keep an insecticide on those cattle, pour on, we have some efficiency with some injectable dewormers that will guard against ticks. But I also like to go back in throughout the summer and fall and pour those cattle maybe monthly if we have to. which we're in our mind, we're pouring for flies to protect against pink eye, but we're also putting that insecticide on that will guard against ticks. And so that will help prevent anaplasmosis. If you get anaplasmosis, then the treatment is tetracyclines. Any others, Ronnie, you had in mind?
Well, just, bovine leukosis, some of
Okay.
the things that can be managed on
So
the farm to prevent spread and
yeah,
those
so
type of things.
bovine leukosis is a tough one once you get in a herd, because it's bloodborne. So if you use this is really painful. Trust me, I've been doing it for 2 years now. We are down to a 1 stick, 1 needle per animal program. That is going to help eliminate the transfer of leukosis from animal to animal. So if you get leukosis in a herd, then blood sucking insects, even mosquitoes can transfer leukosis, probably not as a high rate as the needle could, or even possibly if you get blood on a palpation sleeve that you would want to change that, things like that. So we're down to a 1 stick program to try to reduce the incidence of any leukosis. And you can also test for both of those, anaplasmosis and leukosis. If you think you have a problem, you can do a test the herd with a blood sample.
I guess we got a little bit ahead. I mean, what's some signs that you may be seeing in the cow herd that you've got those present?
Okay, so anaplasmosis, you're going to see weakness. I saw one the other day at a buddy of mine who had me come look at something, and I said that cow was actually a bull. He was really pale. I didn't send the blood sample in, but we treated him, and he was better within about 2 weeks. I said the other day, but it was a few weeks ago. 2 to 3 weeks, he was looking much better. So you're going to see weakness, not eating as much. If you can look at mucous membranes, they're going to be pale. So you can even try to look in the eye. It's not as easy as doing a FOMACHA on a sheep, but you can look in the eye and see if that conjunctiva has lost its pinkness or redness and is more blanched out. You can try to look in the mouth, even though that's not easy on a cow to do that. But the vulva of a cow are some areas that you can look at to see if it's pale. And they'll be weak and not want to eat, is the signs that you see. For leukosis, usually the first signs noted are down cows or cows that are losing a lot of weight. And so there's 5 places and hopefully I can remember them all since I mentioned it. There's 5 places in a cow that it's a virus that'll cause tumors to grow. And the tumors will grow at the heart base, at the abomasum, kidney, udder, and the spinal column. Okay, the one we see is the spinal column because the cow will go down and we can't figure out why she went down. If you palpate, sometimes you can get your arm up there far enough to feel that tumor growing down out of the spine. And that's usually when we see the leukosis. That's pretty much it, other than if maybe they're losing weight because it's in the abomasum, or they're weak because it's at the heart base and it's causing blood flow issues.
What do you think about vaccinations? They just approved not too long ago for vaccinations for anaplasmosis to come into West Virginia. And, up here, I've had quite a few producers opt in to get the vaccination for anaplasmosis, but like down south, everything has anaplasmosis before a certain age. You don't have to worry about it. But up here, that's not the cause. What do you think about the vaccinating for that?
Yeah, I think it's worth a try because we certainly have seen quite an emergence of it, and I think even worse over in your area along the Ohio River. We've seen some here, but not quite as much. I would say it's worth a try because the type of bacteria it causes that attacks the red blood cell. If you have it, I mean, it can be pretty detrimental. And unless you treat it in time, and then, like I said, it'll respond to tetracycline. So, if a vaccination is offered, I would think that I would try it.
Okay. deal.
All right. Are we about wrapped up here, JD?
Yeah, Ronnie kind of beat me to the punch there. I was going to ask if anybody, any guest out there had any questions or any
Go ahead.
comments that we wanted to cover. Anybody else have anything?
I just wanted to mention the next Friday, April 16th, Cliff Little from Ohio State Extension is going to be talking about poisonous plants and livestock and grass tetany. Friday, April 23rd, we're doing a segment on planting the backyard orchard for our apple and peach growers, backyarders out there. And then Friday, April 30th, we're going to have as our guest Dr. Ray Smith, and he is a forage specialist or agronomy and forages from the University of Kentucky, and we're calling that treating pasture as a crop. So those are our next few segments that are coming up for Mountaineer Farm Talk.
And don't forget, we're having a special on the Friday the 16th. We're having a special guest a little earlier.
Oh, that's right.
Because I want to get him his recording for also another event we're doing.
And who's that gentleman, John David?
That is Dr. Justin Reinhardt. He
Reinhardt
is a very brilliant man when it comes to development of heifers and breeding soundness exams and all the reproduction cycles of the cattle. All aspects of reproduction. He is spot on. He's a man that can go into a classroom, teach you how to do it, but also step right out back.
Where's he from, John David?
He's in the University of Tennessee. He's a beef specialist right now there. But he actually came through WVU. He was at Mississippi State for a little while. He is a good guy, and I'm sure he's going to bring a lot of relevant topics to the table.
You tell Justin I said hi.
I sure will.
Okay, we have any other questions? If not, we want to thank everyone for tuning in, and we will see you next week. And I will here. I'm gonna find recording. I'll stop recording here in just a minute.
I think you might have paused it because it is blinking now.
Good discussion. Are you all getting close to getting them where they're